Welcome to the Plastic Surgery Podcast, where we talk about all things plastic surgery. We're going to be discussing cosmetic, correct?
Correct.
Cosmetic surgery.
Absolutely.
That's correct. Okay. Awesome. So we have one topic today, and that is tummy tucks. So, Dr. Viennes, what is a tummy tuck?
Well, a tummy tuck is a procedure also known as an abdominoplasty that's used to improve the contour of the abdominal wall. So patients who have extra skin, it's a method by which we remove that tissue for the patient. Also, the other thing that we look for patients that come in that have a bulge of the abdomen is a hernia, which is basically a defect of the abdominal wall. It's a hole where intestines might come through that we may have to correct, as well as looking for any kind of separation of the muscle. So we have a six-pack. The muscles that we look at when we talk about a six-pack, those muscles sometimes may separate from one another, especially after pregnancy or after a lot of weight loss. So we look for that on the examination. It's not a hernia, but it's basically a stretching of the muscles. If the patient has that condition, then we repair those muscles. We bring them back to where they belong, to the midline, in order to improve the contour. So it's a combination of fixing the abdominal musculature and if there's a hernia, fixing the hernia, and removal of the skin. And sometimes we also add liposuction in order to contour everything with the rest of the body.
It's purely just for excess skin?
Well, it's for excess skin, and also while you're there, because it's part of the operation, is to fix anything that's underneath that you can tighten up the abdominal wall.
Okay. How exactly is a tummy tuck performed?
So what we typically do is we'll make an incision, a horizontal incision along the lower abdominal wall. And it's usually located around the crease fold where the extra skin is folding over top of. And that incision can extend pretty far laterally on the abdomen. And those are usually indicated, the ones that we make the longer incision are for those patients that have a lot of skin. So the more skin you have, the longer the incision has to be. Gotcha. And the less skin, the shorter the incision. In fact, we also do procedures called a mini tummy tuck, which is usually a relatively short incision. And it also only focuses on the lower part of the abdomen instead of the whole abdomen. So if a woman, let's say, for example, or a man for that matter, comes in and they just need some tightening of the lower abdomen, it's a limited tummy tuck procedure.
Now, just a quick question. Is a tummy tuck ever like a necessity?
Those patients that are candidates for medical indication for abdominoplasty are those patients that, for example, have so much skin there that it compromises their ability to perform activities of daily life.
Like basic daily functions.
Right, exactly. So this is skin that really hangs down really low, or those patients who have had chronic infections or rashes or skin breakdown under that fold. Also, the other patients that might be candidates for medical reasons for doing the procedure are those patients who have such significant separation of the muscles that you need to bring them back together again. Those are the ones that also may be candidates from a functional standpoint in order to repair that muscle separation, which there's a medical term called diastasis recti. So it's the rectus abdominis muscles that are separated that we have to bring back together.
How lenient are insurance companies in covering tummy tucks?
Well, each insurance company has its own criteria for coverage. So some require the skin to be hanging at a certain level of the abdominal wall. Some want to show documentation of rashes or skin infections and so forth during a period of time. And that's pretty much it. Yeah.
So some are more stringent than others, but I mean, overall, do most insurance companies have some kind of criteria for tummy tucks? Okay. All right, moving on. What kind of issues can occur when a tummy tuck is performed?
So some of the complications, fortunately, they're relatively rare, and they can be minimized by proper patient selection. In other words, if you have a patient that is a cigarette smoker, we usually like to have those patients stop cigarette smoking at least a month before surgery and after surgery because those patients may be prone to developing tissue loss, skin necrosis. And so we definitely want those patients to stop smoking prior to their surgery. Patients who have excessive weight, those are patients that may have a higher risk for complications related to the operation. And so we'd like to get them on a weight loss program. We also want to make sure that patients don't have any infections or any other medical problems that may impact on their healing. In other words, patients that might be diabetic, we want to make sure that their blood sugar is under control and so forth. So we want to properly select our patients, but there are risks that are inherent to abdominoplasty, as with most surgeries, such as infection, bleeding. We usually lose minimal amounts of blood during the procedure. There will be an incisional scar depending on how much skin has to be removed. And the other complications may include a seroma, which is fluid accumulation. There's some things that we can do to help prevent seroma. Seroma is basically fluid that accumulates between the tissues because we wind up undermining the tissues off the abdominal wall muscle when we remove it. So we're basically undermining the skin and the fat layer above the abdominal muscles, and then we're pulling it down like a window shade to tighten everything up. And there's a space that is created between the muscle and the fat layer. And in that space, you could potentially accumulate fluid, which we call seroma. So we usually put drains in, and we can also use specialized sutures that we put in that actually attach the tissues, the soft tissues, in other words, the subcutaneous fat layer, to the abdominal wall muscles. And that helps reduce the open space where fluid can accumulate.
It doesn't sound like the complications are that serious if there is any problems, but
there could be a serious one.
Right.
And,
so I was going to
this
ask.
This is one that is inherent to an abdominoplasty. This is the risk that is associated specifically with abdominoplasty in cosmetic surgery, and that is a blood clot can form in your legs called a deep vein thrombosis. And that blood clot can travel to your lungs and you can die from that. Fortunately, the risk of that is very low, and so we do take precautions for that procedure, for this procedure to help minimize that risk. And one is to make sure we get the patient up and about walking right away. And also we give them a blood thinner during surgery and after surgery. And some people actually give the blood thinner prior to surgery. And so you have to balance the blood thinning, which may increase your risk for bleeding, and the prospect of reducing the risk of a blood clot.
How long does it normally take to recover from a tummy tuck? And then going along with that, what are some of the long-term effects of having this procedure?
As with any operation that we do, the greatest amount of strength that you're going to get from the scar tissue is in about 6 to 8 weeks. So up to that point, you have to watch what you do. In other words, you have to minimize exercising, avoid lifting items that might be more than 10 to 20 pounds, and squatting, and those types of activities, right? Exactly. Because what you don't want to do is put a lot of pressure on your abdominal wall musculature and have a separation of the muscles that you've repaired underneath, and also putting a lot of tension on the skin closure. So 6 to 8 weeks, typically, patients are pretty much up to doing what they would like to do as far as exercising and so forth, but gradually increasing it. But typically, people return to their activities of daily living in about 1 to 2 weeks.
And then long-term effects. What are the long-term effects?
Some of the long-term effects that we look at are the scar tissue that forms. We typically like to place silicone over top of the scar to help reduce the scar thickening. Scar massage is important. And the patients may develop some numbness, usually an area below the belly button. on the lower abdominal wall, because that's the area where the nerves are the greatest distance from where they are providing sensation from. And that area gets kind of stretched out along the lower belly and midline area. The other problem that may develop is that the patient may feel a pulling sensation because of the scar tissue, which also tends to resolve over time as well.
Are there any situations where a patient comes up to you and wants a tummy tuck and you just completely refuse them? I know you mentioned those who are overweight, maybe cigarette smokers.
Well, I think, again, it goes back to patient selection. You want to have a home run with each case. You want to minimize the risks. So from a medical standpoint, if the patient has a condition that would increase their risk for the operation, then I would probably not perform the operation unless we can control the problem. For example, if a patient comes in and their blood sugars are high and they're totally out of control, then if we can get the patient under better blood sugar control, if that can be corrected, then yes, we could proceed with the surgery. Now, if we have, a patient that comes in and let's say is well overweight and they want a tummy tuck and it looks like it's going to be an unsafe operation, then of course we will not do the operation.
Right, and that's because they are at an increased risk for like these post-surgery complications or...
Right, exactly.
Okay, gotcha. Are these common? Like, are they relatively common?
Well, it's one of the top 5 procedures that's done here in the United States. The other ones are like breast augmentation, liposuction, eyelid surgery, rhinoplasty, which is nasal surgery.
But is that in the entire
country, U.S.?
Right. Yes. But is that just in the cosmetic surgery field or the entire?
The cosmetic.
Oh, okay.
That's the top 5 operations in cosmetic surgery. Yeah.
Okay, thank you guys for watching the Plastic Surgery Podcast. We'll be back next week. Make sure to subscribe and we will see you guys next week. Thanks for watching.